After spending the weekend at George Washington University Hospital in Washington, D.C., Dick Cheney could be released and head home Monday, says one of his daughters.
Well, he's feeling better, and I'm hopeful he'll be released tomorrow, be able to go home.
The former vice president was admitted to the hospital on Friday. He was in Wyoming when he started feeling poorly and flew to Washington, where he's been treated before. He's 69 years old and has a history of heart trouble, having suffered 5 heart attacks over the last 32 years.
So it was there, it was chest discomfort.
9 years ago, he had a defibrillator implanted to monitor his heart and shock it back into a normal rhythm if it started beating abnormally.
Mr. Vice President, how's your health?
It's good.
Since April of 2007, when Cheney gave that report to Bob Schieffer, he's been in the hospital for atrial fibrillation, an abnormal rhythm in the heart's upper chambers, treated for abnormal heartbeat with an electric shock to restore normal rhythm, and suffered his 5th heart attack, described as mild.
A mild heart attack is certainly better than a severe heart attack.
But if it's the 5th in a series of heart attacks, what does that tell us?
They haven't caused a massive amount of damage, or otherwise he wouldn't be able to be treated and be released from the hospital.
The heart is a pump, explains cardiologist Dr. Antonio Gatto. And since a weakened heart pumps less forcefully, he says, fluid builds up in the lungs.
This can be treated by giving medication, giving diuretics to get rid of the excess fluid.
Dr. Gatto confirms that what Dick Cheney's daughter hopes is very much a possibility, that the former vice president could be released tomorrow after a nervous weekend for his family. Russ?
Jim Axelrod, thanks a lot.